HIV/AIDS ethical and legal issues in South Africa. As just additional information about HIV/AIDS, HIV/AIDS is not a notifiable disease in South Africa, which means it is not compulsory to record the names of the patient. There's no register of patients. When they test HIV positive, their names are not recorded. So it remains a confidential diagnosis. If anyone discloses or contacts the patient regarding the information on their HIV status or discloses the information on the patient's HIV status, that will constitute a breach of confidentiality. The country knows how many patients are HIV positive, as in the data currently there are 7 million people living with HIV/AIDS in South Africa, but there is no record anywhere of the names of the patients who are HIV positive. Other issues in this ethical issues and legal issues which will be addressed in this presentation will be issues of informed consent and issues of confidentiality versus disclosure, which will be explained in detail in the following slides. Treatment access and treatment adherence. With the current test and treat policy in South Africa, where people are advised to test for HIV and access treatment regardless of CD4 count, treatment access becomes a medical ethical issue. Treatment needs to be available and accessed by patients as they are being tested. And if there is no access to treatment, it can also become a legal issue. Patients with HIV/AIDS have reproductive rights, and it is the duty of the medical practitioner or the treating practitioner to explain those rights to the patient. In addition, there is a stigma associated with HIV/AIDS, and this can lead to discrimination of HIV/AIDS patients, which is illegal in South Africa to discriminate anyone based on HIV/AIDS status. In this slide, there are 3 medical ethical issues addressed, which is patient autonomy, informed consent, and confidentiality. Patient autonomy is one of the principles of medical ethics. It means that the patient has the right to refuse or choose their treatment. Therefore, in this case, the healthcare worker needs to ensure that the patient has sufficient information before any treatment or any procedure can be done. In this, we give an example of an HIV test. The patient needs to know the nature of the test, the effect of the test, and the consequences of the test. With regards to informed consent, the National Health Act number 61 of 2003, Chapter 2, states that every healthcare provider must inform a patient of the range of diagnostic procedures and treatment options generally available, and the benefits, risks, costs, and consequences generally associated with each option. For the patient to make a decision whether to consent to doing the procedure or to refuse the procedure, they first need to be informed. With the example of HIV/AIDS testing, there are a number of tests that can be done for HIV tests. The examples are, there's what is called a rapid test, there's what is also called ELISA test or Western blot test. Those tests are all accurate, but they differ in cost and how they are done. And this information needs to be given to the patient first before they can decide which test they would consent to do, or which test they can they can afford to do, or is affordability. This relates to affordability of the test, and also it relates to justice as it refers to fair distribution of scarce resources, as it is the case in South Africa. Currently, the test which is recommended for HIV testing is rapid test, as it is accurate and it's affordable and it's cheaper than all the other tests. It's only in exceptional cases where an expensive test like ELISA or Western blot test would be done based on the clinical indications for a more costly test. With regards to confidentiality, the patient, the right to confidentiality must be assured. Right to dignity and non-discrimination refer to every person has inherent dignity and the right to have their dignity respected and protected. And no actions should be taken against any individual solely on the basis of their HIV status, as we have mentioned already, as this will constitute stigma and discrimination, and it is illegal in South Africa to discriminate anyone based on their HIV status. Right to privacy and confidentiality. All personal information concerning a client or patient, his or her health status, treatment or stay in a health establishment must be kept confidential unless ordered by the court of law or done so for the advancement of the client's care and treatment after following the necessary procedure. This is one of the exceptions to the right to confidentiality, where patient clinical information can be disclosed without the patient's consent. That is where it's an order by the court of law. Exception when disclosure of confidential clinical information can be made without patient's consent. More on informed consent. As we have mentioned already, informed consent refers to a person being given relevant and appropriate information about, in this example, an HIV test, and based on that information, given an opportunity to either accept or refuse to do the HIV test. Informed consent should always be in writing and signed by the client or proxy and the healthcare provider to avoid unintended disclosure of results. Confidentiality exceptions to ethical and legal rule. We have already mentioned a court of law can order the healthcare establishment to make the disclosure, and also another exception is where it's an act of parliament which can require the healthcare establishment to make a disclosure. Those are the two exceptions to ethical and legal rule. There is a moral or legal obligation on the healthcare establishment to make a disclosure to a person or agency that has a reciprocal moral or legal obligation to receive the information. In this case, it can be an example of a GP giving and communicating confidential clinical information to a specialist, or it can be maybe a nurse, it can be another healthcare provider communicating with another healthcare provider in the interest of treating the patient. The patient needs to consent to the disclosure. Outside these exceptions, a breach of confidentiality may result in an action of invasion of privacy or defamation. With regards to disclosure of confidential clinical information, the Health Professions Council of South Africa guidelines for good practice in respect of HIV, healthcare providers must use discretion. The decision to disclose confidential clinical information must be made with great care. If the healthcare provider decides to disclose against the patient's wishes, the healthcare provider needs to explain to the patient first what the disclosure is about, what what is being disclosed, and follow the following steps. They need to counsel the patient on the importance of disclosure. For example, with an example of an HIV positive patient, it is important for the patient who is has tested HIV positive to disclose to the partner. This is one example. Or disclose to the family in order to get family support. In that case, the healthcare provider needs to explain the importance of that disclosure and also advise on possible adverse consequences of the disclosure, support the patient to make that disclosure. And if patient still refuses, inform him of ethical obligation to disclose and request consent. And once the patient discloses the information, the healthcare provider needs to be prepared to justify and defend the decision. That is, if there are complications and the patient comes back to say the information has been disclosed and it's the consequences of disclosing the information have been adverse, and the patient becomes aggrieved about that disclosure. And the healthcare provider in that case needs to accept full responsibility and defend that decision. Justice is one of the 4 principles of confidentiality, as we have already mentioned in this presentation earlier, that the 4 principles of confidentiality are patient autonomy, respect of autonomy of the patient, and justice is one of them, also including malfeasance and beneficence. With justice requires that all patients are treated equally and fairly, and in the South African Constitution, Section 9 provides that nobody may be unfairly discriminated against on one or more grounds, including race, gender, pregnancy, marital status, ethnic or social origin, color, sexual orientation, age, disability, religion, conscience, belief, culture, language, and birth. In conclusion, cost-benefit analysis and health outcomes have impact on ethical considerations when delivering healthcare services. Routine HIV testing and screening with opt-out is consistent with ethical principles, and this is in line with respect for autonomy of the patient, where the patient can decide whether they want to opt out and not do the testing, or they would want to do that HIV testing. While testing and investigation and treatment of diseases is in line with the Constitution and other laws, there is need for significant and sustainable financial resources. Hence the 4 principles of medical ethics, being beneficence, a practitioner should act in the best interest of the patient; non-maleficence, first do no harm; justice concerns the distribution of scarce health resources and the decision of who gets what treatment. This is in line with fairness and equality in giving treatments to patients, and respect for autonomy of the patient. Thank you.